My name is Liza Doran, and I am a research associate at the National Alliance to End Homelessness. Thank you so much for being here today as we launch the second of our Unsheltered Count webinars. Today we'll be talking about the basics of Unsheltered Count in our 101 presentation. We'll hear from a representative from HUD as well as a representative from Las Vegas and Winston-Salem, North Carolina. The National Alliance to End Homelessness is a leading national voice on the issue of homelessness, and the Homelessness Research Institute is the research and education arm of the National Alliance to End Homelessness. Today, all of the lines will be muted to facilitate the call, and a recording of the webinar will be posted at our website after the webinar is complete. If you do have a question that you would like to direct either to one presenter or all presenters, please submit your questions in the chat box. After all of our presentations are complete, we will have a Q&A session with all of our presenters for approximately the last 30 minutes of the webinar. We will do our best to answer as many of your questions during that time as possible. And if you have a question for one specific presenter, please indicate this when you ask your question. To get us started today, William Snow from HUD will go over the unsheltered PIT guidance and standards from the federal government. Then Michelle Fuller-Hellauer from Las Vegas, Nevada will give us one example of a community's unsheltered count. And Andrea Kurtz from Winston-Salem, North Carolina will provide us with another example. And finally, as I mentioned, we will end with a Q&A. So now I will pass this off to William.
All right, thank you very much, Liza. Okay, so I'm just going to share a little bit about the basics of conducting an unsheltered homeless PIT count, but I want to thank the Alliance for putting this on. This is extremely helpful, and I hope that you as communities benefit from this. I think this is a very useful opportunity to learn about the basics. So I'm just going to go over the unsheltered point-in-time count standards as published in our recent methodology guide, the point-in-time count methodology guide. And I'll go over a little bit on the methods for conducting an unsheltered PIT count. We'll talk about some of the factors that go into deciding what's the appropriate method or methods for you and your community. And we'll conclude with a few additional considerations for the point-in-time count standards. All right, so let's start with some of the basic standards. Standard number 1 says that COCs are responsible for planning and conducting at least biennially a PIT count of homeless persons within the geographic area that meets HUD's requirements. So there are two things I just want to point out there. First, COCs are responsible. Doesn't matter who COCs hire or who they get to help. At the end of the day, they're the ones who are on the hook. And so I just want to put that out there to be clear that COCs should be involved in the point-in-time count planning process as much as possible, just to make sure that they're meeting all the HUD requirements, but also fulfilling the needs of the local community. I'm hoping you guys are using the data for other reasons, and I've definitely seen that. And so we want to encourage COC involvement early and often. And then the other standard here within standard number 1 is the count must be done at least biennially, which is every other year. And we are moving into 15, which is an odd year, and we expect all COCs to conduct an unsheltered count in 2015. So we're very much looking forward to the information that we glean from this upcoming count. So I'm going to jump to Standard 11. Standard 11 highlights the definition for the unsheltered population. COCs must be able to verify that the unsheltered homeless people identified in the count are unsheltered on the night designated for the count, as defined in the homeless definition. And I'm not going to read the definition, but I just want to be clear that the standard must be met in terms of who is unsheltered. And actually, this is a statutory requirement for who we count in the point-in-time count. So that's particularly important when you're counting over multiple days as well. You still have the requirement to make sure that people are meeting the unsheltered definition on the night of the count. So you're still pegging back to January 23rd, even if you're conducting a multi-day count and you're on January 27th. You still got to go back to the 23rd. And meeting the definition for unsheltered is important, and that's, it's one of those fun areas where we get lots of comments on, especially when we release our point-in-time count data, as we recently have. We just got to remember that there are important limitations in terms of who is counted, but they are important, and we shouldn't take that lightly. And so, just a reminder that there is a definition we got to abide by. Standard 9, this is actually what I'm going to focus most of my content today as we go into listening to community examples. So it says, COCs must account for and report on all unsheltered homeless people residing in the COC's geography through a census or complete coverage, or one or more sampling and extrapolation methods that are consistent with HUD standards and guidance. And HUD will evaluate the nature and basis for estimation and extrapolation of COC's unsheltered count in the annual COC program competition. So I highlighted a few things here. I'm actually, again, not going to talk about the census and sampling piece just yet, because we're going to cover it really throughout the rest of my presentation. But I do want to highlight that the annual COC program competition is where HUD does its evaluation. We certainly do scoring based on your point-in-time counts, and that's the place where we kind of do kind of compliance in some ways, make sure that you're following the standards that we put out there. All right, standard number 10 is a fun one, and this is relatively new. I don't think many COCs were following this guidance in the past, and I think many have asked for this kind of allowance. And in it, we state that COCs may exclude geographic areas where the COC has determined that there are no unsheltered homeless people, including areas that are uninhabitable, like deserts. COCs must document the criteria and decision-making process used to identify and exclude specific geographic areas. The two most common examples here, we get extreme desert areas where really people can't inhabit it. It's just not safe. So we allow for exclusion of that. There's also the opposite. There are some very nice neighborhoods that are gated, and there's just no way that there are homeless people there, or it is highly, highly unlikely. We leave it up to you guys to prove the likelihood. So if you have some sort of way of documenting that homeless persons are not there, maybe you've gone there in past point-in-time counts, maybe you've used your street outreach team. There are various ways to get at it, but you need to show some documentation of why you would exclude an area. All right, so let's jump into the methodology piece of it. There really are two core methods when it comes to conducting the unsheltered point-in-time count. So there's the night of the count approach, which is what we commonly refer to as the street count. And in that, people are hitting the streets. They go out at night, and they find homeless persons, and they count them, or they go out over a couple of nights, and they associate all the homeless status to a single night, as we mentioned earlier. Like if January 23rd were the night, if you're doing it on the 27th, you're still tying all your homeless questions back to January 23rd, the designated count night. The second approach is the service-based, or sometimes we call it the post-night of the count counts. And in that, COCs are going to various service locations or public or private locations, often done over multiple days. People or communities are usually deciding to do this as a supplement, actually, to the night of the count approach. There are some that do service-based as a standalone because they feel that they're able to reach the population better through this. And these are the type of evaluations we leave up to Continuums of Care to decide, what is the best approach. But at the end of the day, these are the two approaches that we have outlined in our guide. And so let's jump a little bit further into what's entailed in that. So with the night of the count approach, there's really three core ways of doing that. You can do a census or a complete coverage. You essentially canvass the entire area. Many continuums are still doing that, although it's difficult. Obviously, the larger you are, the harder it is to cover. There's known location counts where COCs go to where they know people generally are who are homeless, and that's where they do their count. I would say that to do known location counts, you need to bear in mind that you still have a responsibility that your point-in-time estimate reflects the entire geography. So if you have, let's say, 3 counties, and the core of your homeless population is in 2 of them, but you know there are some in the 3rd, you just don't know well. So you do your known locations, and they happen to be in the 2 counties. You still need to use some method of extrapolation to account for people in that 3rd county. And that's something I'm not sure continuums have done across the board. Often known location stands on its own. But again, we want to remind you, you need to make sure that your estimate reflects your entire geography. Some COCs actually use their service-based count in that 3rd county in this example to try to get at that population that they know it would be really difficult to catch on the night of the count, but that they're likely to catch through a service-based opportunity. Finally, you could do a random sample of areas, which is just that. It's selecting what your geographies are, kind of bottling them into small groupings and determining what your geographies are, and then doing a random sample of them and counting based on your random sample. There's more sophisticated ways to do that, like stratified random samples. Those are ideal, but we recognize many COCs are still volunteer-based. There are limited resources, and so we didn't want to break your back totally, and so some of this we're trying to find the balance of getting a more accurate count with the reality that some COCs are well endowed with resources and others simply are not. And there are limitations that have to be kept in mind. And so we tried to do that. A few things for the service-based count. Certainly we're trying to make sure you do that only if you need to, right? If that's the way to reach an audience you wouldn't otherwise reach, that are unsheltered, we certainly encourage it. But we do have a time limitation, and this actually applies to both the night of the count approach and the service-based approach, which is you can't count more than 7 days after the designated night. So again, if you chose January 23rd, your count should not extend past January 30th. And even within that, you need to be using surveys to do your deduplication. So we have no problem with COCs doing a count over multiple days. We do have a problem if the data quality plan isn't there, and specifically a survey to determine if persons have already been counted in the previous days. This 7-day has been helpful, especially for some of the subpopulations like youth. We think this should help expand the opportunities to find homeless populations, but again, that's more resource intensive, so it's one of those decisions that has to be made locally. Finally, we recognize that there's no one-size-fits-all approach, so we don't expect everybody to do a census count. It'd be nice, but we don't expect that. It would be virtually impossible, especially for some of our larger state areas. So that's one of those things we recognize, and we're open to seeing different types of methodology. However, they need to be within the confines of the 2 methods I stated above, which are the night of the count and the service-based. Again, lots of variation within there, but those are the 2 methods to work within. So a few other factors to consider as you do the count. I've already mentioned geography. And so you should be asking questions like this. Which geographic areas within the COC are most important to completely cover during an unsheltered count? So I'd encourage COCs to put a special effort there. Obviously, there are some areas that have high concentrations. Those areas should certainly be considered, and generally, you should go out and count those areas. The minor exception might be if you do a random sample, but you'll want to check your sample to make sure it's truly representative. So another thing to consider is how large a geography you actually have to cover. That's something, again, I've mentioned a few times. We have areas like Long Beach, California, which is relatively small, and they do a complete coverage because they have that. It's not tiny, but relative to other places like Clark County, who we have on the call today, it's easier to get to the entire geography. The larger the geography is, the more we would expect that you'll end up counting through different methods. We wouldn't expect a full census cover if you're doing an entire balance of state. Again, we won't just tell people not to. If you want to go ahead and do it, we would love that, but we don't expect it. So geography is one major consideration. Another one is available resources. So obviously, if you are able to do a complete coverage, that's awesome. It usually requires a lot of organization skill and time on the night of the count. Many COCs fully engage their street outreach providers and many of their providers on that night, which means that it's all feet on the ground, but a lot of time and work within the COC resources. So very intense on the night of the count. Sampling can be equally intense, but also requires a level of expertise, right? If you're going to do a random sample, for instance, you need to make sure that you have an adequate estimation of what the geographies are. You need to have somebody who can help you run a random sample before you do the count. You need to have somebody who can help you do extrapolations after the count. You may have that expertise within your COC, but you may need to engage a university partner or someone else who has that expertise. Another factor is, again, you all would know, is your availability of volunteer resources. Some COCs have an abundance of volunteers they're able to use. They just have a great network and a great history. I would use Boston as an example. They have a great tradition of doing their count, and they're actually able to get great participation because of that tradition. And so we encourage you to consider your volunteer resources. I would say from the HUD perspective, we're trying to encourage our federal partners to engage. We recently talked to folks at the Department of Defense, and they have people spread out all throughout the areas. We have Guard members and reservists who are in, all over the nation. And they asked, what's a way that we can engage them? We said, we'd love to have them involved in the count. And so we're trying to make that available, so they may call you if you're a COC and ask, how can we help? How can we volunteer? You may call them as well and say, we'd love to have you join us. And so that's another resource that's often untapped. We're also trying to get folks like our Veterans Affairs or VA partners at the table, and they've been good at trying to engage. Another thing to think about is extent of coverage. Again, if you have an area that you know there are a lot of unsheltered homeless persons, but you're not confident that if you just hit the street one night, you're going to be able to catch them all, that's a great kind of thing to point out that you should be using service-based approach, at least to supplement your data, if not as your core method. And so that's one thing to consider. Also the date. So it's fun to pick the dates. Obviously there's a lot more factors than I originally appreciated when I started doing point-in-time count guidance and worked on point-in-time count. And so I've always kind of found it fun to see what COCs come up with for dates. And here's just a few things to consider as you look at dates. Is there a day of the week where you can get volunteers or enumerators? Is there a date that's most likely to, result in the best count? You also have events to consider. I know we've had a few COCs run into events where the local law enforcement will actually clear the streets because, there's a convention going on or a celebration, and that tends to result in a lower count just because the homeless have been pushed out. And so that's certainly not ideal for doing the count on a night like that. You also need to think about if you're going to do a multi-day count. And again, at HUD, we're not discouraging that. We think multi-day counts may be useful. It takes more resources. You have to think, do you have the resources? You really have to make sure your deduplication plan is in place, and that typically is in the form of a survey. You really should be using surveys. But before you make that decision, we really want you to consider what you're going to benefit from a multi-day count. Some COCs have helped us understand youth in particular. A multi-day count can be fantastic for identifying youth, and it's very appropriate. In fact, not just looking at multiple days, but different times that the counts are conducted. Engage your youth community when you're making a decision about whether or not you should do a multi-day count. But also, sometimes there just is not the resources to do it. So weigh the benefits with the costs. There's also the actual time that you're doing the count. I already mentioned youth. We hear often that youth are not in places that are easily identified in the middle of the night or early morning hours. However, you might find them more easily at like 5 o'clock in the evenings after they've gotten out of school. Now, to do that, obviously, you generally need another partner who knows where to find them. A partner like school education liaisons are great for helping identify youth or other populations. I think the VA, they're fantastic at identifying where veterans congregate and can help identify a good time to find them. So that's just, another big consideration is time. And also there are some times that are just maybe better at identifying people who actually sleep on the street. Some people count at 10 o'clock at night because it works in their COC, whereas that may not work in other areas. They may need to count it early in the morning hours, like 4 o'clock, 4 in the morning. So I want to wrap up with just a few other considerations, and I know this is one of those like preaching to the choir situations. I know you guys are all well versed in these things, but I will still take the opportunity to highlight them. Just remember to engage your community partners early and often, especially as we're considering all of the subpopulations. I've already mentioned youth and veterans. We know that there are great partners if you have them in your local area, like the VA, like your education liaisons, youth service providers, and engaging partners early is just such an important part of it. Reviewing your survey to make sure your questions first meet HUD's requirements, and then second, to make sure that you're asking the appropriate questions to the appropriate audiences. You may have slightly different questions you ask your youth audience than you do your veteran audience or your chronic audience. Generally, the adults, the questions can be the same, but that's not always the case. But we know more and more, especially with youth, there are sensitive issues that come up with the way questions are worded. But that's a general reminder for questions. Questions can make or break how well you get your data. COC should also create a plan for deduplication, especially over multiple days. Again, that's not new stuff. We've talked about that before. And finally, COC should train volunteers on effective ways to find and interview homeless persons. That's typical of every COC. That's a big deal. Training those volunteers on how properly to engage and how to be safe in doing it is a key to having a successful count. So I, again, wanted to close with these things. I want to thank all of you for all the work you do. I know how much work you do on the point-in-time counts. I try to go out every year and participate in at least one, sometimes multiple counts, just as a reminder of how important the work is and to be a part of it. So I want to thank you again. I'm going to turn the time back to Eliza.
Thank you so much, William. Next, we will hear from Michelle Fuller-Hellauer out in Las Vegas, Nevada.
Okay, this is Michelle Fuller-Hellauer from Southern Nevada. Can you hear me okay?
We sure can.
I'm not able to see the slides. Are you putting the slides up?
I can do that for you. One moment.
Okay, thank you. Michelle Fuller-Hellauer. I'm the Continuum of Care Coordinator for the Las Vegas Clark County Continuum of Care. We refer to it as Southern Nevada because it encompasses all of Southern Nevada, which is Clark County. Next slide, please. So with our COC planning, we start early with planning. Our county encompasses 8,091 square miles or 487 census tracts. So it takes a lot of manpower and a lot of volunteers bring to the table to ensure that we have good solid planning. So we have planning teams that come together, and we try to incorporate all of the local jurisdictions, so all of the cities that are incorporated in our county, as well as service providers, our first responders from each of our jurisdictions, including fire and rescue, as well as Metropolitan Police Department. We include our mental health providers, COC representation across all levels, so our COC board, as well as COC evaluation working group and other working groups that we have in our continuum, as well as past leadership partners. We have regular meetings of that planning team to determine where we're going to deploy from, how we're going to move forward with gathering volunteers, how we're going to strategically distribute the volunteers, and if there are any changes or modifications that we need to make from previous homeless census. Next slide, please. So generally, our methodology, we follow the methodology that William was so thorough about discussing just a few minutes ago. That includes our shelter count as well as our unsheltered count. Our count takes place over a 36-hour period, and we ensure that we collaborate with the Northern Nevada Continuum of Care and Balance of State Continuums of Care to ensure that we are doing the bulk of our count on the same day, so that we can truly say that we have statewide data, and it helps us to minimize duplication. So we have an urban canvassing, so that's really what we call the valley, the Las Vegas Valley area. That's our population center of the county, if you will, and then we have our rural canvassing. We have specialized teams for our tunnels that go into the city, as well as our youth teams, and then we have the school district that assists us with our report. And I'll talk a little bit more about each of those and how that's more specific to our county. And then we also have the street and shelter surveys. Next slide, please. So our unsheltered count, we use the census tracts, the federal census tracts that are used when they do a census. We have our GIS, our map out the census tracts for our county, and then we take our previous homeless census counts and plot them on that census tract map to identify the census tracts where we have not previously found any homeless when we've done our homeless census. And then we do, starting last year, we started doing an overlay with data from our first responders. Our first responders are now identifying when they get a call on someone who is homeless, and that data is then overlaid with on our map to identify if there's been any calls on a homeless person in a particular census tract. So if there are no homeless contacts in previous census and no first responder calls, that tract does not get counted. So we gray out that tract from the tracts that we will be counting as we move forward with our point in time. Then we identify from our census tract map and where our deployment stations are, how we're going to strategically distribute those census tracts, and identify who our deployment captains will be. And then when we do our volunteer recruitment, we assign volunteers to deployments to ensure that we have full canvassing of the areas that we are going to cover. Next slide, please. When we do our census deployment, we have deployment happening at multiple times. So our urban canvassing or deployment previously has happened around 2 o'clock in the morning. This year we're going to move that a little bit earlier and start at midnight because it will help. We anticipate it will help us with more volunteer involvement. And so folks, I deploy from deployment stations midnight or 2 a.m. previously for the urban count area. Our tunnel teams come together at 5 a.m. They go out into our tunnels. Those tunnel teams are made up of outreach teams that are generally in the tunnels, as well as outreach into our desert areas, on a regular basis, so those folks are familiar with the tunnels and familiar with the folks that are living in the tunnels. We also have homeless navigators on those teams, so those are folks that previously came out of the tunnels and are now housed and moving toward self-sufficiency. And then we have Metropolitan Police support in the event that they need that support. Just some areas are a little more dangerous than others, and so having that Metro Police support on hand is invaluable. But not the police our Metropolitan Police Department is very active in participating in our homeless census and are partners in all of the efforts that we have in our community. Next slide, please. Then we move into our youth census component, which takes place about 10 a.m. on the same day that we started our census. We have youth teams that deploy, so we've got folks that are currently working with our homeless youth and young adult homeless service providers. We have volunteers as well as homeless youth or formerly homeless youth that can help us to do that deployment. Prior to the youth deployment, in the months in planning, we have done specific focus groups that identify things for us to look at and areas to target, kind of visual identifiers that will help those teams to identify the youth that are truly homeless and not in school, as opposed to youth that are in a homeschool situation or in a charter school situation. Those teams go out to the specified areas, targeting areas that came out of the focus groups, such as malls, parks, recreation centers, fast food restaurants, those types of things. Next slide, please. At the same time, the school district, we have one school district for our whole county. The school district is working in collaboration with us, and they do an update on their records during that same day for the youth that are in school and identify where they slept last night. So the school district then gives that information to our office, and we kind of peel that data apart. They have identifiers in the school district information to help us know whether they were on the street, whether they were on the street in a family. If they were in a family unit, we assume that we counted them during our actual canvassing. If they are unaccompanied and on the street, then we assume that we probably did not count them because we know that they do not sleep in areas where our adult homeless population generally sleeps. And if they were in a car or an RV, again, we assume that we counted them in our canvassing, so we do not count them. So those folks, we also peel out other things such as couch surfing and doubling up because those are not eligible for this homeless point-in-time census. So using all that school district data, which is happening at exactly the same time that the school district's updating their data, exactly the same time we have our youth teams out canvassing, so that we have deduplication of those youth. So they're either in school or they're not, and either way they're being counted. Next slide, please. Next slide, please. So our rural census then takes place later the next morning. This is our very rural areas. We have a lot of small little towns and villages that are part of our rural areas, as well as vast desert and mountainous areas. So we have code enforcement and animal control that help us with counting those areas. They are generally in those areas on a regular basis, and they know where the homeless tend to congregate, but they also know the areas and can get into various areas where general volunteers would not be able to. Metropolitan Police Department also helps in those areas, and we also have Metro air support. So Metro has helicopters that fly over our very mountainous areas and do infrared to identify if there are people that are in those general areas, and they're able to give us a count so that we can add that to our overall census. We use recreational centers in our rural areas for deployment, as well as family resource centers and homeless service providers. In the rural areas, we try to do the survey at the same time that we're doing the census. We have some great partners with family resource centers and homeless service providers that we're able to do those concurrently. So that's a great way to utilize resources in our rural areas. Next slide, please. So essentially, process census tracts are distributed. We've got various meetings that really lay out who's going to do what ahead of time, ensuring that everybody knows what they are expected to do, what their responsibilities are, what their assignments are, what deployment station they're going to be at, and then we have a general report back. So we do a lot of training ahead of time. We have meetings at various levels depending on what volunteer position somebody will be holding. We have community trainings as well for community volunteers, as well as trainings with our first responders, Metro Code Enforcement, Animal Control, as well as those folks that are in our deployment stations. So with that, next slide, please. We do a lot of pre-planning that leads us to the day of our census, and then we have a written report where data and charts are generated from Servius. It's a HMIS module that is separate from our general HMIS data that's done through our through BitFocus, who is our contracted HMIS software and administrator. And then full report is compiled from the data from Servius, from COC knowledge, and from that contractor. The report is a very large report, around 150 plus pages, and it's found on our website at helphelphome.org. That ends my presentation at the moment, and I will pass it back to Liza, and if there are questions, we'll take them at the end. Thank you.
Thanks so much, Michelle. And our last presenter today, before we move into Q&A, will be Andrea Kurtz from the Winston-Salem area, North Carolina.
Okay. Thank you all very much. I'm happy to talk with you today about the Winston-Salem Forsyth County street count. I'm assuming you can see our PowerPoints. So I wanted to give you a little bit of overview about our community. Our Continuum of Care, the Winston-Salem Forsyth County COC, covers a one-county service area. And from the map you can see Winston-Salem is obviously the largest municipality in our community, and we have 5 other incorporated areas that we serve, but we tend to find most of the homeless people in the urban core of Winston-Salem. Our county population is about 360,000 people, and 230,000 of them live in the Winston-Salem area. Our street outreach effort, our point-in-time count, we always do it the last Wednesday of January. Our community has also committed to do it the last Wednesday of July, so we do 2 counts every year. The committee that organizes those counts comprise representatives from our COC, including the street outreach team, our 10-year plan, representatives from the Veterans Administration, youth providers, representatives from our faith community, and then Centerpoint Human Services is our local mental health management agency. Usually 4 to 6 weeks before the count, we begin gathering information on locations of the camps around communities where we see people sleeping outside, as well as where there may be, if we want to add a site base to our count. Traditionally, we only do a site-based count at our local soup kitchen the afternoon after our street count. We also identify where our command center is going to be. It's typically at our day center. Every once in a while we've had to move it for various reasons. We also bring resources to that command center to try and entice people to come in. So the Salvation Army brings their canteen to serve hot coffee and hot chocolate and tea. We sometimes have healthcare mobile units there and clothing providers as a way to entice people to come in for services. And we will also have on-call service providers. So we always make sure we have some shelter beds either at the shelters or in the winter at overflow shelters for people who decide they want to come in. And then we also will have connections to mental health and crisis teams on call during that period. About 4 weeks before the count, we start soliciting volunteers and donations for gift bags, and we organize the routes and the maps from the data that we gathered earlier. Oops. 1 week before the count, we have volunteer teams that assemble the gift bags. We email the shelters all of the forms that they will use for the shelter count surveys. And we do a training for the agency staff of those shelters, some of whom will be doing the count at their own agencies and some of whom will be doing the count on the street with us at night. They also begin recruiting people who've been staying at the shelters to help the night of the count. And then we also assemble clipboards, so every team that goes out gets a clipboard, and on that clipboard it has emergency contacts for both the police and count organizers, but also services that people they encounter may want to interact with. And we notify the police at this point of the count date and the areas that we'll be sending teams into, so they know to be on the lookout for teams. We also have ID badges that all of the counters wear, and so we make sure that we have enough to cover all the volunteers during that period of time. On the night of the count, we again, that afternoon, contact the police, make sure they know and go over with their people who will be out that night from the police department that we have counters out, tell them where we have identified that we're sending people. We also do the volunteer training right before we send people out on the street, so about an hour before the count we do a training with them. People are assigned into teams, so they often come, volunteers will come with groups that they want to count with, but we have very specific requirements about who's on teams, which I'll go over in just a minute. We send teams out in 2 different shifts. The first shift goes from 9 to midnight, and we find that during that period a lot of people are coming into camps and starting to settle in for the night, or if not, those teams can identify where we might have active camps. And we often have about 25 to 30 teams out between 9 and midnight covering the county. And then we do a shift from 1 to 4 a.m. and in between those 2 shifts we will take all the information our first teams bring back to us about where they may have either found people or where they found camps that looked like they were active, and we will use that to send the later night teams back out to try and hit those more active camps. And then we have also been experimenting with site-based counts the night of the count. So one of the things that we did for the last couple of years is develop a youth spot. So we've had a very difficult time finding unaccompanied youth in our community. And so we developed something called Youth Spot, and we've been advertising that as a event for unaccompanied youth the night of the count. Across the county, we've been working with our school liaisons, with our youth in transition team that works with young people aging out of foster care, and our community rec centers, and any of the other people who sort of step up and say we're working with unaccompanied minors, trying to get them to advertise this place to entice young people to come to us and we just advertise it as a fun hangout spot for the night of the count, particularly in January when the weather's really bad. And we've had a couple of young people come in to that, which has been exciting. And then we also do a service-based count at our soup kitchen between 11 and 2 the following day. And this is a way for us to interview people who may be harder for us to find. So we don't tend to find people if they're in abandoned buildings or cars. And so we often will find them in the soup kitchen the next day. And there's just one soup kitchen that serves our whole county, and they serve lunch every day, which is why that for us is the best place to find people. The way we identify sites is we send emails to past volunteers. So one of the things we found is that once we have people volunteer for us, they become much more aware of what homelessness looks like out in the community where people may be camping out. So we ask them if they've seen any active sites recently. We talk with the police department, fire department. Our empowerment team is our street outreach team. They used to be the PATH team, but they're no longer specifically a PATH team. We also have our homeless caucus and the representatives on the COC who help provide site identification. We talk particularly with residents from the winter overflow shelter because typically they are people who will sleep out at other times of the year when the weather is not bad. So we will talk with them about where to help search for people. And then we also talk to leadership from some of the smaller communities about what they're hearing in their towns or villages about where people are camping out. We always send our teams out with gift bags to give to people. It's a way for us to entice them to take our survey. In the winter, we try and put things that people in the winter will need in those gift bags. We do ball caps, socks, toothpaste, bottles of lotion or sunscreen, chapstick. We collect tote bags for people, canned food that's shelf stable, and bottled water. Clearly I switched these on the slide. Sorry about that. That's the summer count. On the winter count, we look for winter hats and mittens and scarves, socks, other personal hygiene kinds of things. We also look for hot hand warmers and blankets for the winter count. We do volunteer recruitment from a number of places. I'm based at United Way and provide leadership to the Continuum of Care in our 10-year plan. So we use a lot of the United Way venues. We use United Way Young Leaders. So for that group in your community, the United Way Young Leaders have a volunteer component of being a part of that leadership group. And a lot of the young leaders we found really like this activity. We also work with local colleges and universities. We found that this is a great place to recruit people who like to stay up super late. So we have a hard time finding people for our 1 to 4 counting teams, but we often find them in the universities around. And then we also recruit people from the faith community. And then we develop special youth teams. So one of the things that we found over time was our adult counters were unwilling to talk to young people they saw on the street because they were afraid of them. So we have developed special youth teams to go into areas where we see a lot of young people out on the street to interact with them. And we recruit them typically from our Youth in Transition program, which works with young adults aging out of foster care, and then also from our local school homeless outreach program. So volunteer activities, in addition to doing the street counting, we have volunteers who quilt blankets and bags for us and do the collections and then help with the setup. And you can see in the picture here some of the volunteers putting together gift bags that we take out with us on the count. As I said, we do the training the night of the count. We review our street count guidelines. We go over tips on interacting with people who demonstrate behavioral health issues. To make sure that there are some safe interactions. We train them in doing the street count survey, and in particular, one of the things we work with them on is developing unique identifiers, which helps us in our deduplication at the end once we have all the data. We have a couple of things we talk with them about in terms of safety. We always have them go out in groups of 4 so that they have a buddy, and we ask them not to separate from their teams. They all wear identifying badges and carry flashlights. And we teach them a general script of how to interact so that people know who they are, who they're representing, and how to, if they encounter a problem, who they can contact. So our teams are made up of 4 to 5 people. There is always at least one current or formerly homeless person on that team to help them navigate through the areas of the community where we know there's camps. And there's always one person who's been on the street count before who is not currently or formerly homeless, just to make sure that we have some experience on every team. We developed the survey. We use a survey that all of our COCs across the state use. I know you can't read the survey here, but this just general. It's a 2-page survey with checkboxes that make it easy for the counters to have a conversation and collect the data. And one of the things we talk to our team about is having one person who's sort of collecting the data and writing stuff down. The other person from the team can engage in the conversation, and found that we're pretty successful at drawing information out of people that way. We tell all of our volunteers that this is not just a night for us to go out and count, but it's actually a search and rescue operation. So everybody we identify is offered the opportunity to come into shelter or connect to services that night. And we make sure that on the night of the count we have resources in the community on call. So all of our street count professionals are on call that night in case we need them to do transportation of individuals to shelter programs or to other services they might need if they need hospital care or more intensive treatment. And then we also talk with Child Protective Services about being on call. We try not to have them actively involved in the count as Child Protective Services because we don't want to scare people away, but we do have volunteers who work for Child Protective Services either on counting teams or available in case we do find young people on the street. And then this is just a little view of what our count looks like over time. It's actually relatively flat, but as a percentage of our total count, our unscheduled count is about 1%. When we did our last street count last year, we found 19 people on the street in our community. And that would be the end of my presentation. If there's questions, I think it's time for that now.
Great. Thank you so much, Andrea. So we will now begin the Q&A portion of our webinar. As a reminder, if you'd like to submit a question, please do so in the question box on the GoToWebinar doc. And if you have a question for a specific presenter, please let us know. So our first question is for Michelle. Can you talk a little bit more about how you include school district data, and do the schools survey all children on the day of the PIC count?
That's a great question. The school district data comes to us as broken out by school as well as age group. So looking at the data, I also am able to identify if somebody is an unaccompanied youth as opposed to being with a family. So the data that I have actually says, that somebody was in a double up situation, or were living with a family or sleeping with another family, and it's broken down by code. So if they were also in an RV or a car, there's a code for that. If they were on the street with their family, there's code for that. If they were unaccompanied, so on their own on the street, there's a code for that. So all of those are coded, and then I'm able to pull out the things that apply to our homeless count, the point in time count that's eligible, and then there's some inferences I have to make. So if they're in elementary school, even if no matter what the code is, I need to assume that, especially early elementary, that they're with a family. So I do have to make some assumptions. So if they're with a family, we assume that we counted them during the canvassing the night before. So those don't get counted, don't get added to what we've already covered. Same thing for those that were in RVs or cars, vehicles, those types of things. If they are identified as being with a family. If they're elementary school, even junior high, we assume that they were counted during our street count. It's those that are in late elementary and particularly high school that identified as unaccompanied. Those are the ones that we add to our street count. So we have all of our enumeration from all of our census tracts, and then we have the school district data that gets added on top of that. So those folks that are left in the pot, so to speak, from peeling out all of the things that I just identified that are not included, we add those numbers of unaccompanied minors that are in school but identify that they are on the street. With the canvassing, again, using the visual identifiers so that we can do the best possible job of not adding to our youth count our young people that aren't really homeless, that are just not in school that particular day. And then we have, for the surveys, we tried something new this past year, and I think we're going to expand upon it. We had what we called a kickback event. So we had a place right after the time that we did our street canvassing, where our young folks could come in, and it was kind of a self-led event where they had some activities that they could do, had some giveaways, had some lunch, and they completed the surveys at that time. So we're really taking kind of lessons learned from that little pilot and making some minor adjustments and expanding that in the community so that we can ensure that we do a better job of getting the surveys completed. But we do have our youth outreach teams do surveys after the actual day of the census. Within those next 7 days, those outreach teams are going out and doing surveys, and our school district, the Title I Hope, our homeless youth program at schools, takes some of our surveys, and they will do surveys for the unaccompanied youth that were identified during their updating of their data. They complete the surveys, and that again is added to the bulk of the data that we collect, and that's then analyzed and included in our report.
Great, thank you. Our next question is for William. When will HUD be expecting communities to be compliant with the 14 standards and the newest PIC guidance? And do the scores for the point-in-time count and the 2013 NOFA indicate HUD's perspective on how compliant a COC is with the 14 standards?
Great question. So we released the guidance earlier this year in August. We're hoping to see steps made towards implementing the guidance for the 2015 count. However, we recognize that some of that may not be done, so we're not going to require necessarily everything. The 2015 NOFA will be reflective of what we include as in terms of scoring and how we're going to look at things. By 2016, you should expect that we'll ask pretty much the full breadth of questions that would get at whether or not you're compliant with the standards outlined.
Great, thanks, William. Our next question is for both Andrea and Michelle. Do you wake people up to administer a survey during the street count? And either way, why or why not would you do that?
So this is Andrea. We do not wake people up if they're on the street count. We train our volunteers to record whatever they can observe about that person. And if either our homeless liaison or one of the experienced people on the team recognize the person, we can give more information about who they are so we can follow up with them later. But essentially we view ourselves as coming into their home, and so we try not to disturb them if they're sleeping.
Yeah, in Southern Nevada, we do not wake people up. It's a visual identifier and we use a tally sheet to identify those folks that we see for the census for the canvassing. Then we follow up later with statistical sampling for the survey, and that's done within the next 7 days.
Great. And again, for Andrea and Michelle, especially last winter, we saw a lot of inclement weather with polar vortexes and snowstorms. How do you recommend handling inclement weather that occurs during a scheduled count?
Well, in southern Nevada, we haven't had snow when we've done our census, but we have had rain. And so we still do our census. We know though that when it's raining, that because of health issues and safety, the count that we have for our tunnels tends to be much lower because when it's raining, because of safety issues, we have our homeless outreach teams go out, and I kind of forewarn those folks that are in the tunnels that they really need to get out of the tunnel in order to not get washed away with the rain and the flooding that takes place here. So we know that during those times we tend to have higher utilization of emergency shelter and overflow, and less folks that are in our tunnels for our tunnel counts. But we still go out and do our census using umbrellas and raincoats.
And this is Andrea. We do the same thing. We continue the count regardless of what the weather is. And we did about 3 years ago have freezing rain on the night of our count in January, and we just sent our teams out. We had fewer volunteers that night, but we did ask them to keep going. We did find some people, almost everybody we identified wanted to come in, and we accommodated them in our overflows. But we also find that when weather is really bad, we tend to have fuller shelters, and our overflows, particularly in the winter, are always full for those nights. Great.
And for Andrea, do you send volunteers to camps for the 1 to 4 a.m. shift? For the people that are, do you send 1 to 4 a.m. volunteers to camps identified in the 9 to midnight shift to see if additional people have come to the camp and to collect surveys, or both? How do you avoid double counting or duplicating efforts between the two shifts?
It depends on what the information coming back from the first night count is. So if they come back and they say we found a camp that was really big but there was only one person there, we may send a team back. But we do, one of the things that we do is try and make sure that everybody we are counting who isn't asleep, that we engage enough information that we have some identifiers that help us with deduplication. So if we can engage them in a conversation, we try and at least get a name that they'll give us and some other identifying details that other counters hopefully will get the same information to deduplicate. And then we also ask for observable details like gender, race, clothing, so that we can then deduplicate from those sites if we have multiple people visiting the same site. And we have had, sometimes we've had teams that are, despite the fact that we give them maps and say this is your area, they get super excited and go into other areas and count. So we've had to deduplicate camps that way too. And a lot of it is just making sure that they are collecting really good information.
Sure. Another question for you, Andrea. Mm-hmm. About how long is the training that the volunteers receive on the night of the count? And did you previously do trainings in advance of the count and move to the night of the count trainings because volunteers were more likely to attend?
Yes. So we used to do volunteer training between 1.5 weeks to 2 weeks before the count, and we found that people would either come to the volunteer training and then not show up at the night of the count, or they would want to come and count but haven't been to the volunteer training. So we do a training that is about an hour before the count, and it takes us, so we use that whole hour to do it. We have a number of volunteers who've been coming back year after year, so while we require every team to have at least one experienced volunteer. Many of our teams are entirely made up of experienced volunteers. And so we found that that 1 hour before the count is enough to make sure that people are safe and that they know what they're doing.
Great. Our next question is for William. When does HUD expect to have the updated mobile app available, and is there a specific contact person that communities should be working with around the mobile app?
Great question. So the mobile app has been one of these fun pieces of the counting process. We've been engaging a contractor to work on the app for, gosh, 1.5 years now, and timing of it has been less than stellar, as everyone's probably noting. So our hope here is to release the app by the end of this month. And the app will, in fact, it'll be free. The software will be free. You can download the app from the Apple Store, from Google Play. However, COCs do have to remember that if they use the app, they need to have an IP address to receive the data in. HUD holds to its standard that it doesn't have a national database of homeless persons or even a local database of homeless persons. And so COCs would have to have, like a computer or the cloud, someplace where data would have to go into from the mobile app. There's not necessarily a contact person, as with other things. We ask you to go through the Ask a Question feature of the HUD Exchange in terms of what your questions are. We're working on releasing, we have a technical guidance, we have end-user guidance. A lot of it is almost ready to go, but we want to make sure the app itself is completed. And that's really in its final testing phases. It's more or less done. So we're hoping to, again, release all those tools by the end of the month. And we'd encourage folks to use the app more as a test run to see if mobile technology is the thing that will work in your community. Because HUD is unable to offer it for free past the 2015 count, which we are rather sad about ourselves. Again, if you think this is a great time to use this as almost a beta test. Does your community adapt well to having mobile technology when when both your unsheltered community, are they comfortable with it, and your enumerator community, are they comfortable asking questions using a mobile device? We're finding more and more that communities are comfortable with it, but this is a great way to find out.
Great, thank you. Our next question is again for Andrea and Michelle. How do you train volunteers to identify both with youth homeless and adult homeless people?
So this is Andrea. We ask them to engage with any adult that they find out on the street and just tell them that they're out surveying and ask them where they're going to sleep that night to begin the conversation. So they engage with any adult. What we found over time is that our adult volunteers were not willing to engage with youth hanging out on the street at midnight. And so that's why we developed the youth-specific teams. We found that young adult, and our youth-specific teams are young adults between about 20 and 24, and they are much more comfortable approaching younger adults or even unaccompanied young people on the streets at night to ask them the same questions. And so we just had to develop specific teams to do that.
This is Michelle. We do a couple of different types of trainings for identification. So for the canvassing teams, those folks that are going out the night of the unsheltered count, there's the identifiers of, they're sleeping on the sidewalk or they're sleeping on the ground. That's a pretty good indicator that they're homeless. And then, we talk about other visuals such as, the clothing, where they have items with them, those types of things. So the visual identifiers that kind of lead you to believe that somebody is homeless. And again, when we do our canvassing, it's literally a visual count, and because we do it, because of the time that we do it, starting this year starting at midnight or previously starting at 2 a.m., folks are pretty much settled. So they're pretty much where they're going to be, and it's really fairly easy to identify that somebody is a visitor in the community, or they're just walking around, as opposed to they're a homeless person getting ready to bed down for the night or already settled for the night. For the surveys, the training is a little bit different. We rely very heavily on for the surveyors on our outreach teams, who already have a solid knowledge of how to identify somebody that is homeless. They also know how to interact with folks to identify whether they are homeless without offending somebody. We also then use our volunteers to do surveys in site areas, such as our dining facilities. So we'll have volunteers set up in our various dining facilities around the community doing random surveys. So those folks, if they're coming into the dining facility or in the area where our homeless do congregate, there's general questions, where did you sleep last night? Do you consider yourself homeless? Blah, 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 those types of questions, to just start the engagement to identify, is this person truly homeless, and should we be continuing with the survey? So, different levels of training based on who's doing what and the type of interaction or non-interaction with the particular person.
Great. And again, for Andrew and Michelle, do either of your communities instruct volunteers to go into abandoned buildings to count people? And if so, how do you handle any safety concerns?
This is Michelle. We do not encourage folks to go into any abandoned buildings. If they identify that they feel that there's a person or persons that are inhabiting abandoned buildings, we ask them to identify where that is on their tally sheet. And then when they come back to the deployment station and they do a quick debrief with the deployment captains, they identify that, and then we will ask either code enforcement or our metro partners to go out to that area to identify whether there are truly our folks in that area and in that building, and how many are there, so that we can get that count, but also to ensure that safety not only for the volunteers but safety for the folks that are in that abandoned building.
And this is Andrea. We have not asked them to go into large buildings, particularly more commercial abandoned buildings. We have had outreach. We will have those buildings targeted by trained outreach teams, so they're more professionals who are going into them. We have had volunteers go into houses that were abandoned, where we had reports from EMS or fire that they were responding to an abandoned house and had suspicions that people were living there. But we give them pretty clear instructions about making sure that whatever the police patrols in that area know that they are actively in that area and going into a site, and that we have at least one person, 2 people staying outside and 2 people going inside, if there's no indication, like if they're going into the house to see if people are in there not responding. But we don't generally encourage it.